is more sure to happen is you are winning the exam and to be in the top 100 ranks. So we invite Dr. House, Rutika, Jumbo, Suresh, Mumbai and many more. Breast is supplied by, typically it is supplied by superior thoracic, internal mammary but not musculophrenic, which mainly supplies the diaphragm, as all of you know very well. A person who is falling from the tree has caught the tree and that led to hyperextension. What will hyperextension lead to? Upper trunk of the brachial plexus injury, classically. So what do you see in the injury of the upper trunk of the brachial plexus? We see all this but not decreased sensation on the medial hand. D should be the correct answer, not A. A small correction, doctor. D is the correct answer, not A for this question. Posterior cutaneous nerve of the thigh doesn't supply the front of the thigh, but it supplies, as the name says, posterior aspect of the thigh. Now, the femoral ring boundaries does not include the artery, but it includes the vein, is what you need to basically remember. So, you are basically draining this abscess here. What is this abscess here otherwise called? Ischio-rectal abscess. There is one more abscess B, which is perianal abscess. So, whenever you are draining it, there is a great chance of injury to the inferior rectal nerve, is what you have to ultimately remember. Roy is saying this is a very nice paper, sir. Now you are learning how to set up a paper. So, yeah. No. Now you are learning, I added. So, but Roy said this is a nice paper, right? So, yeah. Nice paper should not be too tough, too easy. We need to strike a balance. But at the same time, at least 20-30 good questions should be there, which will be the deciding factor. So, in a nice paper, like a nice student, you should cross 150. Then I am the happiest man in the world, if you tell me that. But still, we will improve. 8 more weeks time. Now, Dr. Histone fundamentally is a basic protein, not an acidic protein. MHC2, the antigen presenting cells include macrophage, dendritic cell, lymphocytes, but not platelets, as all of you know very well. Autosomal dominant pattern is already given. Sorry, that's the reason it is a nice paper. So while setting question, I thought of removing this somewhere. I missed it. So which renal cyst will show this kind of a pattern? Actually, this is an autosomal dominant pattern. So autosomal dominant is the nature of the medullary cystic kidney disease and adult polycystic kidney disease. That is what you need to appreciate. In esophageal cancer, you have P16, P53, cyclin D, but not the KRAS. One oncogene, definitely they will ask, doctor, you have to review. Then regarding mitochondrial DNA, codes for what? tRNA. Yeah, it is a maternal inheritance. Then protein synthesis is inhibited by Shiga toxin, diphtheritic toxin, not Purchases toxin, is what you have to appreciate. All toxins, mechanism of action. 5-6 toxins are there. Clostridium, diphtheria, Purchases, E. coli, Shigella, cholera. Right? One toxin, definitely they will ask every entrance you go. One vasculitis, without that, where is the APPG paper? So microscopic polyangitis does not involve a large vein or a large artery, but it involves arterial capillaries and venules, is what you need to appreciate. So what is the clear differential diagnosis for microscopic polyangitis? Polyarteritis nodosa. But polyarteritis nodosa doesn't involve lung, whereas microscopic polyangitis involves lung, which is the differentiator. Periodic acid-Schiff positive structure is which one in the kidney? Endothelial cell is not, whereas mesangial matrix, globular basement membrane and proximal convoluted tubules, brush border, they are all the ones which are involved. What is this histological variant of Hodgkin's lymphoma? Lymphocyte predominant nodular sclerosing variety of Hodgkin's lymphoma. So basically it will be CD20 positive is what you have to basically appreciate. Then I leave the literature for you, nodular versus, different varieties of Hodgkin's lymphoma, everything you need to be very clear. How many of you have done this question wrong? Oh, okay, histological slide might have misled you, alright. But what is the baseline of the game of the ABPG, TNPG, Karnataka PG is no more there. TNPG, Maharashtra PG, lymphoma, leukemia, compulsory question, right? And doing wrong is, you can think 50 ranks, piche, hat gaye, so such 10 questions you would go wrong means 50 into 10 exponential effect, 500 ranks out, right? But don't do counting in exam hall. See, but the point is you should not do mistake in leukemia and lymphoma. No way you can afford to do a mistake. Okay? So, if you have done this question wrong, once more, go through the Robbins, look quickly through how to identify the histopathological appearances of Reed-Steinberg cell lymphoma varieties, what are the CD markers, etc. blah blah blah, everything. But be sure when you go to the exam. Incus, which is present in India, is a magistrate inquest, police inquest. Trial jury is not there, medical examination system is not there, coronary is not there. Then, what is this wound injury? Incised like wound, it is called as. Typically more common on the scalp, and it is is the voice okay? Can online students, can punch as a voice is loud and clear for all of you? Dr. House is reporting voice is not clear. Okay, that's good. So, incised like wound is what has been given. Positive benzidine test is hemoglobin, myoglobin, even myoglobin will be positive for positive benzidine test. Endemic ascites is Junjunia seeds. Another 3 months you remember them. Superficial venous thrombosis involves cerebral white matter. Deep venous thrombosis involves grey matter. So where is the grey matter present in the brain structure? Thalamus, basal ganglia, they all contain the islands of grey matter in the ocean of white matter. Typical description of our neurology chief. So, what is missing in your brain is that grey content, in spite of a huge white content, is what he used to intimidate the residents. Yeah. When they join PG, intimidating professors, constipated facial expressions, how to manage your chief from where you are getting MD degree, first 6 months, so chale jata. Once more, last 6 months you need to consider him. In the middle time you can ignore him. So that way. Anyway, that is another part of the story you need to survive after this. Now doctor, which is the drug which inhibits the c-KIT and also used in CML? Typically, imatinib, mesylate has revolutionized the clinical management. Then drug A, what drug typically is a topoisomerase 1 inhibitor? Typically, topotecan, irinotecan, etc. You should not forget. Answer what is given? Oh sorry, answer was wrong. It was a typographic error. Please correct the key. Please correct second wrong. Why we do these wrongs like this, there is a secret for that. Suppose if somebody xeroxed the question paper, did not pay us the fee, so he will get the wrong answers without proper explanation. So that is the idea. So, yeah, actually that is not the idea, but it's little lethargic. Some mistakes, human mistakes of typography. The typist may have a sudden urge of an emergency coitus while working in the middle, and he may run around, and then in the midnight he will have a difficulty. So A ho jata hai, B ho jata hai, C. So sometimes drug A, drug B, what do you typically define? Beautiful question, doctor. How many put populo kalu for this question? Put their foot in the dal. Yeah. Just little encourage me, doctor. How many did wrong? Everybody did right. Good, good. So, methotrexate is the inhibitor of dihydrofolate reductase. 5 for the uracil is of thymidylate. Synthase is what need to be remembered. 2-year-old boy has been sent. Jumbo is saying voice is having echo. Please check. Yeah. A 2-year-old boy has been sent to the vomiting for 24 hours. Greenish to start, but over the last few hours became brownish. Depressed fontanelle are there. Then what do you see here? Incarcerated inguinal hernia classically. Then 5-week-old boy vomiting intermittently for 2 weeks. This became incessant for the last 24 hours. The mother noticed some twitching of muscles. Baby is dehydrated. Ultrasound abdomen, what is it showing? Thickening of the pyloric part. So which is classically the feature of hypertrophic pyloric stenosis. Few days after birth, the neonate has abdominal distension, blood-stained stools, and what is abdomen showing? X-ray, necrotizing enterocolitis, classically with all the air distributed along the wall of the bowel is what need to be remembered. A 2-month-old with Down syndrome with abdominal distension with bilious vomiting and delayed passage of meconium with distended abdomen, what is your diagnosis? Classically, he is a Hirschsprung's disease with a congenital megacolon is what need to be remembered. A premature neonate with respiratory compromise requiring ventilation, and you have done the radiograph. So typically there is a diaphragmatic herniation, congenital diaphragmatic hernia with all the gas-filled bowel loops entering into the thoracic area is what you have to basically remember. Now doctor, a mother who has suffered, very happy to see 68 online viewers, a mother who has suffered polyhydramnios has given birth to a baby who has Down syndrome, and the baby has bilious vomiting. So what do you have here? Double bubble sign. 2 bubbles of gas shadows are there, which is typical of duodenal atresia, which is intestinal atresia. A neonate has a bile-stained vomiting, blood-stained stools, very sick, and you have passed a contrast. So what is it showing? It is typically showing a highly placed cecum, which is due to malrotation of the gut, is what you are classically seeing in the radiograph. A 60-year-old has a right hemicolectomy with cecal carcinoma. He is fit for surgery, and he has got a Duke C tumor. What is the best option which is in his given case? Adjuvant chemotherapy. If you have done this question wrong, colorectal cancer doctor, APPG last 20 years में not even a single exam without a question on colorectal cancer. There was no paper. All 20 years, 20 questions are there. If you want, you will anyway come to our crash course on APPG last 20 years. No, I'll show you. Colorectal cancer may Bailey and Love may, what are all the when will you do artery resection, when will you do chemotherapy, chemoradiotherapy or radiotherapy or a palliative therapy or a neoadjuvant therapy, all the clinical scenarios you must be reading after you go home. 92-year-old who has rectal cancer presents with the intestinal obstruction. CT, what is it showing? It is showing liver mets. So what is the best treatment in his given case? Multiple liver mets are there. 92-year-old, where will you put knife on him? So palliative care is what you have to ultimately do. A 50-year-old with anemia, colonoscopy reveals a cecal tumor, CT scan does not show any spread. What is the best treatment you want to do? Young individual, 50-year-old female is young individual. So there is a reason you can do a curative surgery in this given clinical condition. Then a 56-year-old fit individual underwent surgery for colonic cancer 3 years ago, and PET is not showing any kind of a mets. Then there is a solitary lateral lobe metastasis into the liver. So what do you want to basically do? So typically whenever there is a solitary liver met and not a diffuse metastatic disease of colon cancer, you can still operate and remove the met. Single met is considered to be the protocol in case of carcinoma rectum is what need to be remembered. Lower rectal cancer, T3B-N1, and there is no evidence of any distant metastasis in a 68-year-old. Then what is the best treatment option which is available? This is a classical indication for neoadjuvant chemotherapy followed by surgery is considered to be the option there. A 20-year-old with history of weakness and deformity of the lateral knee, 3 digits of the right hand, and typical distribution of the cutaneous loss of innervation, sensation. This is the classical distribution of median nerve. So that is the reason it is a median nerve palsy. Once more, the rule is one question on brachial plexus, radial nerve, ulnar nerve, musculocutaneous, axillary nerve, blah blah blah. Definitely one question, right? Froment sign and which in muscle weakness will lead to Froment sign. All this funda you must be ready, doctor. Lumbricals, what is their mechanism of action? What is a lumbrical? Will it lead to flexion of distal interphalangeal joint or a metacarpophalangeal joint or a proximal interphalangeal joint? Whose flexion and whose extension is caused by the lumbrical? Flexion of metacarpophalangeal joint and extension of interphalangeal joint. You can remember lumbrical. What is this joint called? Metacarpophalangeal joint flexion and extension of interphalangeal joint. Right? And anyway, interossei is easy to remember. Dorsal interossei are what? Pad and dab. Dab and pad. Dorsal are abduction and that's good. Then tracheostomy, what is the excerpt about it? You cannot palpate a trachea that easily in case of children, unlike in case of the adults where the Adam's apple is very well developed. Very well developed is what you need to basically remember. So one of my cousin, she got recently married, calling me and saying, I'm very happy in married life and we finished our honeymoon, and in fact my husband is cutting the apple. Suddenly I asked, Adam's apple or regular apple? Because we were all framing the question mode. So which apple is he cutting? Is he cutting Adam's apple is much more challenging thing. So toxic love. So trachea cannot be easily palpated. Adam's apple cannot be easily palpated in case of children. For the diagnosis, what is this condition? Choanal atresia, it's called as. You can see both nasal airways got blocked posteriorly, right? You can see the blockade, right? Bilateral choanal atresia. So we do all these investigations. Posterior rhinoscopy we do, not anterior rhinoscopy is what you need to remember. Breath sounds you need to auscultate. Endoscopy, red rubber tube, they are all the ones which are indicated. except is missing. Oh, sorry about it. Huh? Yeah. Recurrent laryngeal nerve palsy, all of them are affected but not cricothyroid, which is not supplied.